So for patients who are hypogonadal, it depends on what your symptoms are. If your symptoms, fatigue is the most common symptom of testosterone deficiency, or the most commonly reported one. So if you give men a checklist of you have fatigue, constipation, sexual dysfunction, erectile dysfunction, low libido, the vast majority of men with true androgen deficiency will check fatigue, and they describe their fatigue as just a feeling of total exhaustion. That's the most common way they describe it. It's exhaustion that even if I sleep 8 hours a night and I have, good sleep hygiene and everything, and I'm not working, a million hours a week, that's how they describe it. I'm totally exhausted regardless how much rest I get. So, the fatigue and cognitive issues associated with androgen deficiency should improve within a month or two, definitely within 3 months. Body composition, which, as I've explained, is very important to our practice, should change within 3 months. Okay. And what do I mean by that? I mean that your skeletal muscle mass, if you're very obese and you're losing weight, so you're in a calorie deficit, your skeletal muscle mass should not decrease too much. Okay. It should more or less remain the same. Ideally, it will increase. Your percent body fat, though, should decrease. It should be trending downward. That should happen within 3 months. Sexual symptoms depends on what you're talking about. If it's like sex drive, that reliably does usually increase within 3 months. It's usually shorter. Some guys will notice a difference almost right away. Okay. Especially they've been living with low testosterone levels for a long time. Erectile function is a little bit more complicated. In theory, if the testosterone is going to help with your erectile function at all, should be within the first 3 months. Maybe it should help a little bit. Okay. So what said all that to say, usually the effects are fast, but everything that's beneficial you should notice a change within 3 months. That's why we follow up with people every 3 months. That's why we check people's labs every 3 months. And that's why we do body composition scans every 3 months, is because the 3-month mark is when you should feel and look different than you did 3 months before. And if you don't, then we have a problem. Either you're not doing something correctly, or most of the time we're just not at a correct dose, or then we adjust things. But everything on a 3-month time scale.